But we also have some great experts. We're going overseas right now. Dr. John Campbell from the Campbell, he's the Campbell teaching founder, medical lecturer, nurse practitioner, and an expert on coronavirus.
Well, welcome to this video. So to give you the bottom line is the first randomized blind controlled trial on vitamin D as an interventive therapeutic in poorly people has been published. And the results are more positive than I could have imagined. Clinical picture of acute respiratory infection. So people came in with acute respiratory infection as a complication of COVID-19. And what they wanted to test for was the effect of calcifidiol. What this calcifidiol is, it's a drug. We use it regularly for other conditions. So when I take these vitamin D tablets here, if I take one of those today, it's going to take a few days for my liver to metabolize that into the active form in the blood. So what this group is doing is they're giving it as the active form. So this calcifidiol is the active form. It's already activated, so it cuts out the liver stage of activation. In other words, it increases the 25-hydroxyvitamin D levels almost straight away. Now get ready for these results, because they are, I must say, when I read them, I was taken aback. 50 patients treated with calcifidiol, good. 1 required admission to intensive care, that's 2%. 26 untreated patients in the control group, 13 required admission to intensive care, 50%. So would you like a 2% chance of being admitted to intensive care? Or would you like a 50% chance of being admitted to intensive care? Now, what this really makes me think about is, I've been talking about this since January. Many reputable scientists have been talking about this, but governments and agencies seem to have been putting it down. Now, I'm not a conspiracy theorist, but you know, this stuff's readily available and it's cheap. When I say cheap, you know, we can manufacture this, or pharmaceutical manufacturers can manufacture this for essentially nothing. And yet more expensive drugs are being used. What's going on here? Why has there been no organised clinical trial by the World Health Organization, the Oxford Centre for Evidence-Based Medicine, the Centres for Disease Control? There's so much evidence now for vitamin D. Why is this not being done? It really is quite strange. Really, I mean, it's just unbelievable that the World Health Organization and all these other centres we've mentioned aren't doing large-scale clinical trials on this. This is readily available, it costs nothing, and yet it's not being done. And more expensive alternatives are often being used. It really is hard to explain.